Risperdal is a favorite for me because it really is very effective. It's as effective as Haldol. Haldol is kind of the gold standard that we had, and especially in the emergency room settings for acute mania, acute psychosis with agitation, patients that would come into the ER and police would bring them in and they would be there on a commitment involuntarily, extremely psychotic and agitated. They would get Haldol also because you could inject Haldol and that would calm them down like that. It would sedate them and it would calm them down. We would combine it though with medication for sedation, but they would sleep and they would be a lot calmer when they would wake up. Risperdal it doesn't come in an immediate injectable form. The injectable forms are for long-term treatment. They're long-acting injectable medications. But once you get a person settled, Risperdal is a great medication to give, or if the patient is voluntary, if they're willing to take medication. And because it's a high-potency agent, it's very effective at treating positive symptoms, but it's got far less drug-induced Parkinsonism than medications like Haldol, less motor symptoms, and then you have the affective benefits. I used Risperdal today. I evaluated a patient today, as a matter of fact, and she was calm and she was cooperative, but very psychotic, paranoid, and she's been having hallucinations for several months. The diagnosis was a major depressive disorder with psychotic features. And so she's been depressed for a long time because psychosis doesn't develop overnight in patients who are depressed. And really her chief complaint was the voices, but also anxiety. She doesn't realize how depressed she is. She will endorse depression. And she tells me that she lost her husband 5 years ago, but her grief had actually gotten better like it always does. Only here lately she's been thinking about him more because as her mood has fallen, she's having mood congruent thoughts. My sense is that she never fully recovered from her grief and that what we're seeing now is a major depressive episode triggered by her grief. But she has a history of being treated in the past with antidepressants and never hospitalized, never psychotic, but she also has a family history. And her mother actually received ECT. So there is a strong family history of major depressive episodes, and she's psychotic because of it. And even though she knows that the voices are symptoms, she believes that her internet has been hacked and that these people, she doesn't know who they are exactly or what their motives are, so the delusions are not that well formed. But she knows that they have this equipment and they've been using this equipment, even though she also hears it at the Dollar General store and when she's out in public, and she can't quite put that together. But, logic, we don't expect logic to explain these delusions because she's hallucinating and they're real to her in the moment. And her insight it's mixed. She can talk about these symptoms, but she believes that there are actual people that are doing this. And so we don't really probe and try to get her to see the cognitive dissonance. She doesn't really have any cognitive dissonance about those two things unless you press her. Her daughter joined us and her daughter said to her, well, how can they have equipment when you're out in public? And the patient just tries to explain it, but then hits a brick wall. She's also having cognitive symptoms. She can't concentrate. And when I ask her how long things have been going on, she can't really tell me. Time spans are difficult for her. So you can just see that she's having cognitive symptoms because she's so depressed. Anyway, I picked Risperdal because it's going to be very effective at blocking those voices. Some of the side effects we're going to exploit, the sedation and the potential to gain weight. She's lost a lot of weight, but also because it's going to complement her antidepressant and help that anxiety, those affective symptoms, and those cognitive symptoms. So it's a perfect choice, or she needs an antipsychotic. She's too depressed for me just to give her an antidepressant. She was given Zoloft a few months ago by a non-psychiatrist. But what she really needs, though, is not an SSRI. She needs an SNRI. I chose Cymbalta for her depression because she's having these cognitive symptoms. She needs something stronger than just an SSRI. So I gave her a combination of Cymbalta and Risperdal for all of her symptoms, including insomnia, which is really one of her major symptoms, a major complaint, and is also leading to some of the cognitive symptoms and some of the other symptoms that you're seeing. She's exhausted. That's how she described her mood, exhausted. I'm going to put that in a separate video, and those of you trainees out there who are